Welcome back. This is Full View. Thank you so much for staying with us. Health Minister Dr Joe Phahla has warned that the Omicron variant of COVID-19 was spreading rapidly amongst children, some as young as 2 years old. He said Gauteng was still the biggest concern, but that the new variant was quickly spreading to all provinces. Phahla said vaccination was still vital because it prevented severe disease. Joining us now to reflect on the minister's comments is Prof Mignon McCulloch, a paediatric nephrologist at the Red Cross Children's Hospital, University of Cape Town. Prof, a very good evening to you. Thank you so much for joining us. Welcome to the Full View.
Great. Thank you very much for having me on your show. And I also represent the South African Paediatric Association.
Indeed, great. Thank you so much for joining us. Now, in the early days of the COVID-19 pandemic, Prof, initial data suggested that children were less likely to suffer from severe cases of COVID-19 than older people. Studies were conducted to yield a much more detailed picture of COVID-19's effects on the overall health of children, their development and their immune responses to infection. Did the minister rely on any medical literature, perhaps, to make the assertion that he made?
So I think, firstly, it's early days. So we're only 2 weeks into this new variant. And so I think everybody is feeling very anxious. And I think it's really important that everybody stays calm. There are a lot more numbers in the community in general. So it's not just the kids, but it's actually everybody where these numbers have increased. We've looked very carefully this week at all the various hospitals. So there are children being admitted, and you're right, some as young as less than 2, up to 10%, and some younger than 9, so 19% are less than 9 years of age. But on the whole, the children are still remaining fairly well. 50% of them are incidental. So you go in with a broken arm, or you go in for some plastic surgery or for some other medical condition, and when you get tested, because now we are testing all the children who go to hospital. So speaking to all the big hospitals in Gauteng that have children's wards, they are seeing an increased number of admissions, but this reflects what's going on in the community. Very few children are in the intensive care unit, and very few are actually on any form of ventilation or life support. And I think that's important. So what we're seeing is that this variant is really going through the whole community. It does seem to be affecting children, but we don't have very many children dying and not very many children in the intensive care units. What it is telling us is that we need to actually get out there and vaccinate. So we need to vaccinate the families, the granny and grandpa, the aunts and uncles, mom and dad, but also the teenagers, because the teenagers have been locked up for 2 years. Most of them have just finished their school exams, and they really want to get out there and see their friends and have a good time. And now that we have vaccines available for the teenagers, I think it's really important to get them vaccinated as well. But I think your high-risk population is still your older people. But for the little ones, parents shouldn't panic too much. If your child is unwell, a fever, a bit chesty, or just not quite themselves, definitely take them for medical attention, either to the local clinic, the GP or pediatrician. And so there are children being admitted, but as I said, on the whole, 50% of them are coincidental. They're just being picked up as having COVID. But It's early days. We need to see what happens in the next 2 or 3 weeks and see what happens with this variant, because it does seem to be more contagious. That's the one thing we can definitely say.
Okay. Now, Prof, let's talk about the long-term immune responses to the disease and the screen for genetic factors that may affect how children respond to COVID-19 infections, and, of course, the determination, as it were, of whether immunological factors influence long-term outcomes.
Yeah. Good point. Very good question. And so the one thing that we're looking at as well is long COVID.
Yes.
So we know that's the condition where you end up with what they call a fuzzy brain, severe fatigue, a bit like what we used to see with post-viral myalgias or yuppie flu, which we had 10 or 20 years ago. So there may be a congenital component with that. It may be related to microclots that are happening in the bloodstream. And so there's a lot of work happening around that. But at the moment, the headline news is this new variant. It's got 31 mutations. And the scientists have told us that unless we actually get as many of the population, old and young, mainly old, vaccinated, we can expect to see more variants. So I think we just need to stay calm and sensible. If you're worried about your child, always go for medical attention. But on the whole, I think we shouldn't get into panic. The hospitals are not completely flooded with hundreds and hundreds of children, and the ICU at this stage are not flooded with lots of children on ventilators like you used to see with the adults in the previous waves. So we cautiously feeling positive, and we're just watching the space. And I think the next 2 weeks will give us an idea as to where we're going. Fortunately, we're in summer in South Africa. Fortunately, the schools are closing as well. But that may also have a downside in that children are actually socially mixing, not wearing their masks and not doing social distancing. So I think it's about being sensible and just making sure that everybody, we know what the rules are. Wear your mask, social distance, clean your hands, and get vaccinated. And I think those rules still apply for children as well as adults.
Professor, should we take comfort in the fact that clinicians report that the children have reported mild symptoms and is not at all a cause for concern?
Yeah, so for children who have got a normal immune system, I think we are seeing mild symptoms, and my fellow pediatric colleagues at Baragwanath, at Steve Biko, all the big academic hospitals in Gauteng have said normal children are just coming in mildly sick, admitted for a day or 2 or 3. The children we always worry about is the same as the adults, those with comorbidities. And I think we just don't know enough about children with severe comorbidities and this new variant. 2 weeks, you'd need to have a crystal ball to know exactly what's going on. But the message we want to get across is vaccinate and stay calm. Don't get panicky. Don't let sort of news reports about hundreds and hundreds of children being admitted to hospital, because that's not what we're seeing at the moment.
All right, Professor, lovely chatting to you. Thank you so much for joining us.
Thank you for having me.
That was Professor Mignon McCulloch, the chairperson of the SA Paediatric Association, and she's a paediatric nephrologist at the Red Cross Children's Hospital, University of Cape Town.